All right, so good afternoon. We starting at 3:30 because there's only one topic that left for us to study before we do the exam tomorrow, and that's going to be your blood vessel. And we're going to go through that, and then we're going to go straight into the models. Okay. All right, so let me share to you the PowerPoint of the blood vessel. Okay, again. Okay, so something's up. All right, so in front of you is the PowerPoint of the blood vessel. Okay, and I'll turn on my pen so you can actually see the writings that I'm doing. Okay, so got the word right on top of it. That means we're on the right screen. Okay. All right, so blood vessels. Okay, so your blood vessels, they're the one that carries your blood together. That is your blood cells in your plasma. And we just need to actually follow through the branches where it goes, and then where it actually branch out into different small vessels until it goes to capillary. So let's talk about the anatomy of the blood vessels first. So your blood vessels has three layers. The tunica intima, the inner layer, and that's actually made of simple squamous epithelium. And the the lining is actually called endothelium. So they have a special name for that lining of the inside of the blood vessel. The second layer is called your tunica media. Okay, so your tunica media is the second layer, and that's the one that you actually have a lot of smooth muscles. So the sheaths of smooth muscle allows the blood vessel to contract or to relax. So when you contract the blood vessel, you're vasoconstricting the lumen, and when you relax it, you're vasodilating the lumen. Now, the last layer is going to be the tunica externa, and that's composed of your connective tissue. Okay, and within that lumen, the cavity, that will have your blood within that vessel. Now, this is the difference between an artery and vein. So if you notice that the artery is thicker, the tunica media, there's a lot of smooth muscle there. So they can actually control the diameter of the lumen more. On the vein, okay, it's not as thick as the artery. And the shape of the vein is mostly tortuous. So they're actually not as round as the artery. So the artery, because it has pressure, because this blood just came from the left ventricle. Remember, the left ventricle pumps blood, so it has pressure. So they maintain that circular shape because of the pressure inside the artery. As soon as it leaves the artery, it connects to the vein loses that pressure. Okay, so next is going to be something going on here. Okay, so next we're going to take a look at the types of blood vessel. We have arteries and veins. Okay, arteries carry blood away from the heart, and veins carry blood toward the heart. But in between the two, the connection between the two is going to be called a capillary. And the smallest blood vessels. And the capillary is actually where the exchange of molecules between blood and tissue occurs. So there are the molecules there that is called your carbon dioxide and oxygen. So the capillaries, the walls are so thin, it allows the gases to move back and forth. Okay, because if we want to remove the carbon dioxide from the tissue, so it's going to move into the venous side, and then the arterial side has the oxygen, so we're going to give it to the tissue. So now this is the different types of arteries. Again, the elastic arteries are just those major branches or the big branch, big vessels, such as your aorta. And usually they're called conducting arteries. And then it has a lot of elastin, and that actually dampens the surge of your blood pressure, because remember, they're receiving the pressurized left ventricle's blood that they pump So they have a lot of this elastine in your tunica media to allow them to flex. And that's actually the characteristic of the elastic arteries. Now, the other arteries, they're going to be distal and they have elastic laminas. And these are called your muscular arteries. If you noted, you got a lot of the laminas that lines up the inner and outer. Okay, so this is going to be the area of the tunica media, and that's actually allowing them to actually have the thickness and the feature that they can actually conduct the pressurized blood towards their vessel. So these are called your muscular arteries, and muscular arteries usually carry the name, okay, that they are associated with, such as the area of the arm. You're going to call it brachial artery, and you got the blood vessel located at the arm there because of the area called the brachium, okay, and that's unique about them. It has internal and external elastic laminae. It toughens the walls because they conduct those pressurized blood from the left ventricle. Now, when the arteries become small, we call it an arteriole. So arteriole is what we call the smallest arteries, and that is prior to connecting with the capillary. The large arterioles still has the three tunics, okay? And this diameter arterioles, they're the one that's connected and controlled by local factors or the sympathetic nervous system. When you say local factors, for example, if there's a decrease in blood pressure, so what they're going to do is going to vasoconstrict to actually elevate the blood pressure and maintain the blood pressure. But the sympathetic nervous system is actually the one that controls that innervation in order for it to maintain blood pressure. Constantly, your blood pressure is going to be have to be constant. So it's going to be a play between the sympathetic nervous system that allows it to maintain your pressure. Okay, and so if you are not maintaining the pressure and it's elevating the pressure, then that is pathology, and that's called your hypertension. Then the smallest vessel is going to be the capillary. So it's connection between the artery to the vein. That's going to be the capillary. And mostly you're seeing them along the lung for gas exchange, small intestines, for exchange of the nutrients that you just digested. And you can see that endocrine gland in order to pick up the hormones. And then you see them also the kidneys, and they're the one that removes your nitrogenous waste, which is going to turn out to be urine. This is what it looks like as a capillary. Now, if you take a look at the capillary, it's so small, okay, that it allows only a single file of red blood cell to pass through. This is the simple squamous epithelium that lines that capillary. And remember, we call it the endothelium. So both sides have that simple squamous epithelium, okay, and we call that endothelium. Now, imagine if you were not a right red blood cell shape, okay, such as sickle. So if you pass through this small lumen, you're going to get stuck. And once you get stuck, it's going to actually clog that flow. And that's the reason why you have to have a specific shape of the red blood cell. And that's going to be your biconcave shape, okay? Any abnormality in the shape would cause problems about blockage onto the capillary because it can only pass through one single file. Now, the capillary allows it to pass through in a single file, and they're single-layer endothelial cells surrounded by a basement membrane. So you don't usually see any of the tunica media or the muscle skated at your capillary. So the capillary's function, it actually surrounds tissue fluid with oxygen and nutrients. It will refresh the tissue fluid because around the matrix of your tissue, you can have a lot of those oxygen and your tissue that need to be replenished, and that will give the replenishment of the tissues that are surrounding the capillary. They remove carbon dioxide and nitrogenous waste, so they go and go through the capillary. And as I said, lungs, oxygen, carbon dioxide exchange, small intestine, the exchange of nutrients. So you're trying to bring in the glucose that you just digested, and that's going to be through the capillaries. And then your endocrine gland hormones, they pick it up through the capillary, so they can actually target distant tissues. And then the kidneys, they're going to be filtering out those waste, such as your nitrogenous waste from the body. And that's done through the capillaries because the walls are so thin. It allows that to happen. Now, this is what a capillary looks like. So the area, this is going to be the arterial, and then the part of the arterial that connects to the capillary, that's going to be called your metarterial. Okay, so we're not at the capillary now. And then it connects to what we call the vein through the thoroughfare channels. And then from there now it goes into the venial, as well as vein. Okay, so these are your different structures that are associated with the connection of the arterial to the venial, which is going to be your capillary. So now you got true capillaries located here. And the two true capillaries, which may not be metarterial and the thoroughfare channel, and that's going to be what your true capillaries are. Okay, and if you notice, there's sphincters located along those arterial and venial and capillary side because they can actually contract. It's made out of smooth muscle. They can contract to divert the blood to other areas of the body, such as when you have a sympathetic response. What's happening is the blood vessel in your skin will actually contract the sphincters of the capillary so that it diverts the blood towards the important part of your body, which is going to be the head, where the brain is, the heart, and the lung, leaving the skin without blood. That's the reason why you feel cold, because your blood conducts heat. Okay, so we're going to be looking now at your exceptions of where the capillaries are not present. Okay, and these are your tendons and ligaments. They're pretty vascularized. Epithelial and cartilage contain no capillaries. Cornea and lens, there's no capillaries. So that means that I can actually use a cadaverous tendon or a cadaverous ligament to replace in your body because there's poor vascularization there. And remember, the cell that actually would reject those grafts are going to be white blood cell. Since you don't have any of those vascularization, so you don't have any of those cells, the white blood cells that are going to be floating and producing tissue graft rejection. So I can use that, and because it's poorly vascularized on these three areas. Now the capillary bed, this is what it looks like. Okay, the sphincters are open. Okay, but as soon as the sphincters close, it now prevents the spread of the capillary blood to the capillary spaces. So it's diverting the blood and preventing it from going through those tissues. Okay, as I said, they're usually associated with a sympathetic response in which they divert the blood towards major organs in your body, which is going to be the brain and the heart and the lung. Okay, so it has the capacity to contract those sphincters. Now, if we talk about capillaries or blood vessels, we're going to actually take a look at some of the vessels are going to be continuous, which is without pores. That's most common. And some blood vessels are going to be fenestrated. That means you have pores. So you can have continuous or fenestrated. So what does fenestrated looks like? Okay, remember that fenestrated is with pores. Continuous is the most common type, doesn't have any pores. And usually the most common area that you see continuous blood vessels is going to be the blood-brain barrier. And that's the reason why it's hard to treat any infection in the brain or it's hard to give medication to the brain because it doesn't allow it to diffuse through any of those endothelial lining because it locks pores. And that is one of the problems that we have in treating any pathology in the brain. So the other one is called sinusoidal, and usually you see this type in a bone marrow spleen. So what does it mean? It actually has a bigger pore, and because it allows large materials to go through. So fenestration has pores, but they're not as big as the sinusoidal. And then continuous, there's no pores right there. So this is going to be what a capillary look like. Okay, and if you notice, this is the only place that things from the inside can go through, and it is called the intercellular cleft. And You don't see any pores here, so they're very tight in the endothelial cells. Okay, so less of the diffusion going out from the capillary, but this is what it looks like when the capillary has pores. So these are called fenestrations. So the fenestrations have pores because remember, large molecules can go through those pores, and that allows them to actually move back and forth between the blood and the tissue. So fluid also allows the fluid to actually go through those pores. And that's the reason why the fluid, when they go into the tissue out the matrix, they're sucked back in by the lymphatic system because capillaries have pores, and you see how the pores are located on the endothelium. Okay. So next, you have different routes in and out of the capillary. You can either do direct diffusion through the cell membrane of the endothelium, or you can go between the clefts, between the gaps between the cells, or it can actually be carried through vesicles. So from one side of the endothelium, it's going to be taken out into vesicles, and it's going to be secreted out to the other side. Or the most common type is going to be through the fenestrations, and that allows that movement go from one area to the other. Now, as I said, blood-brain barrier have a tight junction, and intercellular clefts, okay, no intercellular clefts are present there, so they're very tight between the cells, the endothelium that are actually not that are actually connected to each other. So only vital molecules pass through, and they're very selective on transport mechanism. Okay, but even though they're very tight, there's not a barrier against oxygen, carbon dioxide, and anesthetics. So anesthetics can actually still diffuse through the endothelium. Okay, except that it doesn't have pores, so there's not a lot that you can actually diffuse out. I mean, not diffuse, but actually would go through the fenestrations because it doesn't have any fenestrations there. So now the other type is called sinusoids, and they're very leaky. Okay, they have a lot of clefts and fenestration, and you see it in bone marrow and spleen. So take a look at the pores here; they're bigger. Okay, and the clefts are bigger. Okay, because remember, bone marrow, they're the one that actually make your blood. So the blood cells has to go through those pores in order to be carried by the blood vessel. Okay, so they got a bigger pores and wider clefts on their capillary. All right, so now we actually described the relevance of pulse points to the clinical anatomy, in which the pulse points is the one that actually you can feel because of the fenestration there. It allows that to produce what we call a pulse on the blood vessel. Okay, so that's one of the things about pulse points. They have a lot of the pores that allows you to feel it through the skin. Next one, okay. So now we talk about the arteries. Now we talk about veins. Okay. Now veins conduct blood from capillaries towards the heart, and blood pressure is much lower than the arteries. In fact, they're almost zero when it goes through a vein. Okay. The smallest vein is called venial, and that's going to be after the capillary, and the venules join to form the veins. And then from the veins, it goes into the vena cava, and then it goes to the right atrium. Okay, so the only thing that is actually thick in this is going to be the tunica externa. The tunica media, which is made out of smooth muscle, they lack a lot of those in that. That's the reason why it's hard to actually maintain. It's hard to actually produce what we call a structure like similar to artery, in which it's rounder. Okay? Veins are more tortuous. Now, if there's no pressure on the vein, how does the blood go back to the heart? Okay, and that's going to be what we call skeletal muscle pump. And within the vein, there's valves. Okay, so the valves is supposed to be a one-way valve. So when the muscle contracts, such as when you walk, okay, even when you breathe, it's gonna squeeze the blood up to a certain level, and then it actually closes the valve so it wouldn't go down to the lower level. So it keeps on putting it like a ladder effect until it goes back to the heart. Okay, And that's one of the reasons why some people actually faint, is because when people faint, it triggers a response from the autonomic nervous system, and it will actually open up the valves, and then all the blood is pulling down to your leg. So when there's no blood going to the heart, there's no blood being pumped to the brain. So when it goes to the brain, there's less oxygen, so they actually become shocked. And that's what shocked is, okay? So if somebody has that problem, we suggest the patient actually go lie flat on the bed and lift the leg. And the purpose of lifting the leg is for the blood to rush back into the heart, so the heart can pump blood with oxygen into the brain. Okay, so that is actually the physiology about people who suffer from syncope or your hypotension. Okay, so next is going to be the vascular anastomosis. So some of the arteries would anastomose with each other, okay, and they're going to form branches. And veins anastomose more frequently than arteries. Okay, and unfortunately, some of the veins are more. Some of the veins are located at the superficial area, and those are called superficial veins. There's no superficial arteries. The only time it becomes superficial is when you feel the pulse points, such as the radial pulse. But most of the veins, some of the veins are seen underneath the skin. And that's a good thing, because that's the one that we use for intravenous insertion. So, but the veins actually anastomose mostly. They sometimes look like nets, okay? But arterial anastomosis happen also. Now, anastomosis means it's spreading out and producing new branches. Now, what is a vasa vasorum? Okay, some of the vessels, such as aorta, the walls are so thick. So it's going to be the walls of the aorta. So this is going to be the lumen, the cavity inside. The walls are so thick, so it's hard to perfuse oxygen and nutrients to the walls. So sometimes they actually have their own blood vessel. So this is going to be a blood vessel. It will go through the outer wall in a blood vessel. So it is actually a vessel of vessels. So it nourishes the outer region of large vessels, okay? And that is called a vasa vasorum, okay? Some of them would have that. Now, the pulmonary circulation is the one that leaves the heart going into the lung and then comes back through the left side of the heart. And that's called your pulmonary circulation. Now, this is what it looks like, okay? So the pulmonary circulation is coming out to the pulmonary artery and it goes into the lung. I'm just tracing one side of that pulmonary artery, okay? And then after the pulmonary artery, remember pulmonary artery is unoxygenated. That's why it's colored blue. It's gonna diffuse that carbon dioxide to the alveoli, which is the sac. This is the alveoli. These are blind sacs of your lung. So within that, that's connected to the outside of your atmosphere. Now, this is a blood vessel called a capillary. So this is coming out from the pulmonary artery, because pulmonary artery carries carbon dioxide. So it goes to the alveoli. There's thousands of alveoli and thousands of those capillaries that wraps around the alveoli. So once they go into the alveoli, the carbon dioxide can just diffuse out from the endothelial cells that lines the capillary, and then it diffuses into the kind of simple squamous epithelium of the alveoli, because they're so thin, in which the carbon dioxide now goes into that sac, and then you exhale that carbon dioxide. And as soon as you inhale, you take in oxygen. So the same red blood cell that actually just disposed of the carbon dioxide now carries the oxygen with it into the side of the pulmonary vein. Okay, and then from the pulmonary vein, it goes into your left atrium and left ventricle and to the aorta. Okay, so that's actually the flow of what we call the pulmonary circulation. So it's happening here around the pulmonary artery and the pulmonary vein. Okay, now systemic circulation is the one happening between the arteries into the vein. Okay, and they're the one that will carry oxygenated blood away from the heart. And that largest is going to be the aorta, and that's what we're going to be tracing now. is what we're going to be studying, the branches of the vessel. Okay, so let me give you a summary of these arteries that you see here. Okay, so remember, there's three vessels that comes out from the arch. So the three vessels that comes out from the arch, one is the left subclavian artery. Okay, and I want to trace what happened to the left subclavian artery. Okay, so the left subclavian artery, and remember the word is subclavian, so it goes below the clavicle. Subclavian goes below the clavicle. And then when it reaches the armpit, okay, what you do is just change the name. So when it goes to the armpit, you actually change the name to what we call the axillary artery. So it just changes the name. And then when it goes to the arm or the brachium, you just change the name. So now the name changes to brachial artery. So it's not a separate blood vessel. It's the same vessel that came from the left subclavian artery, and you just keep on changing the name. Okay. So the brachial artery goes straight down into the area of the median cubital fossa, and then from there they divide into two. One goes to the radial bone side, another one goes to the ulnar bone side. So you just change the name. So the name of the artery after the brachial artery that goes to the radial bone, you call it radial artery. And the name of the vessel that goes to the ulnar bone, you call it ulnar artery. Okay, so it's just changed the name. Now, after the radial and the ulnar artery, okay, they become an arc. And that is called your palmar arc. Okay, so the palmar arc is connecting the radial and the ulnar artery. And after connection, it's going to give off branches from the arc to the fingers. And those branches is going to be called digital arteries. Okay, so it's very actually easy to actually trace vessels. So it's not a complicated structure. So they're just changed names constantly. Okay, so what happened to the common carotid artery? The common carotid artery goes to the neck, and it's going to separate into two. Okay, the one that goes outside the face. This is the common carotid of the right common carotid. The one that goes outside is going to be called the external carotid artery. That's going to supply the neck, the face of the person, okay? That's called the external carotid artery. But there's another one that goes inside the head to the brain and supply oxygenated blood to the brain, and that's going to be the internal carotid artery, okay? So simple. The common carotid divides into two, internal and external carotid. The external carotid stays to the neck and to the face. And not just face, but the whole head. And the internal carotid goes to the brain, okay? And that is from the common carotid, okay? So, but remember, one of the vessels that is on the arch is called the brachiocephalic artery. And the brachiocephalic artery is still divided into what we call the right common carotid and the right subclavian. So whatever the path of the left subclavian is, it's the same thing as the right subclavian. So it goes to the armpit, axillary artery, and then it goes to the median cubital fossa, and then divides into the radial artery and the ulnar artery. That's what happened to the right subclavian artery, but it came from the brachiocephalic. And the common carotid is the same thing as the left, okay? It's gonna have a branch going outside the face, and that's gonna be your external carotid, and the other one goes to the brain, and it's gonna be your internal carotid, okay? Now, where do I get blood vessel? Into the thoracic, to the abdominal, and to the leg, okay? And that is actually where the descending aorta would come in. So the descending aorta, remember we have the ascending, the coronary arteries come from the ascending, the arch, the three vessels come from the arch, and then the descending is the one that goes down to the back of the heart. And then when it actually goes to the back of the heart, it's going to be at the thoracic cavity. You just change the name to thoracic aorta. So it's just changing name. And then when it penetrates the diaphragm, this is just thoracic aorta, it penetrates out to the diaphragm. The blood vessel just changed the name to abdominal aorta. So you're actually just not making new blood vessel, you're actually just changing the name. So the abdominal aorta will actually give branches to the abdominal organs, okay, and we'll actually take a look at that also. And we're going to take a look at the branches of those external carotid, the axillary artery, and subclavian. But I've just given you the path of the big vessels that is moving out from the heart. So the abdominal aorta has to divide into two because it has to go to the leg. So that division is called since the bone is the iliac bone around that area, we're going to call the division as your common iliac artery. Okay, the common iliac artery has to divide again because they need to actually give blood into the pelvic cavity. So the common iliac, once it divides, one will actually become your internal iliac. That's the one that will stay inside the pelvic cavity. But the other one will proceed down to the leg, and that's going to be the external iliac artery. Okay, so same vessel with a different name. So as soon as it passes through this inguinal ligament, now we're at the we're at the femur now. So the external iliac will just change name, and the name is going to be femoral artery. Once it actually goes to the back, this vessel will go to the back of the knee, which is going to be the popliteal popliteal fossa. So once it goes to the back of the knee, just change the name, popliteal artery. And then from the popliteal artery, it divides into two, one to the front of the tibia and one to the back of the tibia. So I should call the vessel from the popliteal artery that goes to the front of the tibia, I'm going to call it anterior tibial artery. And I'm going to call the one that goes to the back of the tibia, I'm going to call it the posterior tibial artery. And then from there, they form an arc called arcuate artery. And then they have vessels that goes to the toes, and we're going to call it your digital arteries. Okay? It's very simple. So nothing actually changed. Nothing actually was made. It's the same vessel, and when they go to a different part of the body, they carry the name. When we go to the femur, we call it femoral artery. When we go to the brachium, we call it brachial artery. When we go to the radial bone, we call it radial artery. So those are the paths of your arterial circulation. Okay, so I'm going to go and start our tracing here. Okay, into the arch of the aorta. Okay, because the arch of the aorta has these three branches here. So the first one is going to be the left subclavian artery, and remember that goes to the arm. So it goes straight to the arm. And the common carotid, left common carotid, this is the one that goes into the neck and then divides to two. One stays at the head and neck and face. I'm going to call it the external carotid artery. And then the other one that goes to the brain, I'm going to call it the internal carotid artery. Okay, and then on the right side, remember the brachiocephalic artery here is just an extension cord because it needs to reach the right side. But they also branch out to what we call the common carotid right and the subclavian artery right. Okay, so it actually just follows this path the same way as the left. Okay, now let me take a look at the veins. So we're here at the veins. Okay, this is going to be the superior vena cava. And remember, once we actually follow the vein, it's always from rivers to lake. Okay, from rivers to lake. And arteries, it's from lake to rivers. So we call it branches. But in veins, we call it tributaries. So what are the tributaries of the superior vena cava? And those are the two vessels called the brachiocephalic vein, right and left brachiocephalic vein. So that's going to be the tributaries of the superior vena cava. So what are the tributaries of the brachiocephalic vein? That's going to be the internal jugular vein and the subclavian vein. Okay, so that's how we trace vein. Now, the vein that follows the common carotid artery is actually called the internal jugular vein. Okay, that's the one that follows the common carotid artery. Okay, the vein that follows the subclavian artery here, we're going to call it the subclavian vein. So now they carry the same name. So there's exceptions in which they don't carry the same name, such as the internal jugular, which matches up with the common carotid. They don't have the same name. Yeah. the vein it's been called to be the internal jugular vein. Okay, so those are the vessels, and those are the ones that we're going to be following through. Okay, so we know that ascending aorta will give branch to the coronary arteries, right coronary, and also the left coronary artery. Okay, and we studied in the heart. And the aortic arch has three branches called the brachiocephalic trunk, left common carotid, and left subclavian. Okay, and the descending aorta, this part here, will change its name to become the thoracic aorta. Okay, descending then becomes thoracic at the area of T5 to T12. And then after that, it's going to actually go down below the diaphragm to become the abdominal aorta. Yeah. All right. So now moving on. Now, this is the hardest part of your blood vessel. Okay. So I try to make it easy by giving you the mnemonics. So, but remember, this is not a complicated structure because the name that we give the blood vessel is actually the name of the location of the part where the artery is. Like if it's going into the temporal bone, we're going to call it the temporal artery. If it's going through the thyroid gland, we're going to call it the thyroid artery. Okay, so the name is not going to be supposed to be difficult. Okay, so the first thing is let's take a look at the branches of the common carotid artery. The common carotid artery has two branches, IE. What is I? Okay, so this is your common carotid artery. I is going to be the internal carotid artery, and E is going to be the external carotid artery. So simple, common carotid, the two branches are I and E. Okay, now I want to actually concentrate on the external carotid artery. What are the branches of the external carotid artery? That's going to be SLOMPSF, slump SF. Okay, so now take a look at how the name is actually made. Okay, S, the branch of the external carotid artery that goes to the temporal bone. We call it superficial temporal artery. So I'm going to look for that artery. This is external carotid artery, and the artery that goes to the temporal bone. Okay, that's going to be the superficial temporal artery. That's for S. Now, what is L? The name of L is lingual artery. So where should I follow that artery coming out to the external carotid artery? So the branch of the external carotid artery that goes to the tongue, that is called the lingual artery. Okay, that's your L. What is O? O means occipital artery. So I want to follow that vessel of the external carotid artery, and that vessel that has a branch going to the occipital bone, that's going to be occipital artery. That's your O. M. M means maxillary artery. So that means that this vessel will go to the maxillary bone. So the branch of the external carotid artery goes to the maxilla, that is going to be the maxillary artery. M. P. What is P? It is called posterior auricular artery. Posterior means the back. Auricular means the ear. So let me see a branch of the external carotid artery that goes to the back of the ear. Remember, this is your ear canal here. So the vessel, a branch of the external carotid artery that goes to the back of the ear, that is the posterior auricular artery. Now, S, what is going to be your S? S is superior thyroid artery. So I'm going to look for the branch of the external carotid artery that goes above the thyroid gland. This is your external carotid artery, and this is the one that goes above the thyroid gland. So that is your superior thyroid artery. That's S. And the last one is going to be F. This is a very common artery that is going to the back of the mandible, and it goes out here at the bottom of the mandible. And that's the one that will actually give blood supply to your face. So if you would actually turn red when you become embarrassed, that's because of the facial artery. So you can actually press on that artery. You can feel an indentation at the bottom of your mandible. And that indentation there at the bottom of the mandible is where the facial artery passes through. and that is called F, facial artery. Okay, so again, if I ask you what are the branches of the external carotid artery, just say SLOMPSF. S is going to be your superficial temporal, L is going to be your lingual, O is going to be occipital, M is maxillary, and then P is going to be your posterior auricular, S is going to be your superior styloid artery, then F is going to be the facial artery. Those are the branches of the external carotid artery, in which the external carotid artery came from the common carotid artery. Okay, all right. So we finished with the external carotid artery. Now I want to see the branches of the subclavian artery. So these are my branches of the subclavian artery. Okay, so this is the subclavian artery, and the branches are called CTVI, Cable TV Incorporated. Okay, and that actually makes it easy for your brain to memorize. So the name of the artery also tells you where it goes. Okay, always the name of the arteries, it tells you where it goes. So the name of the artery for C is called your costocervical trunk. Okay, so where do you think it will go? Latin for rib is costo, and then cervical is the Latin for neck. So I should find a branch of the subclavian artery that goes to the neck and to the rib, and that's going to be my costocervical trunk. So if I take a branch, okay, that goes to the neck and the rib, that is the costocervical trunk. Okay, it's costocervical trunk. Now, again, what is T? It says thyrocervical trunk. Thyro means thyroid gland. Cervical means neck. I should see a branch of the subclavian artery that goes to the neck in the thyroid gland. Okay, so that branch is going to be this one. See that this goes to the thyroid gland, and this goes to the neck. Okay, simple. Thyrocervical trunk. Okay, then V. V is actually a very famous vessel. It's called the vertebral artery. So I want you to actually look at this later on and see where it goes. Okay, the vertebral artery is the one that goes to the side of the cervical vertebrae. Okay, then it goes up, goes inside the brain, and then will meet up with the internal carotid artery. So they're gonna anastomose. So you got a blood vessel that supplies to the back of the brain and a blood vessel that supplies to the front of the brain, okay? And the vertebral artery is the one that goes from the back of the brain, okay? Now, doesn't that explain why cervical vertebrae has a hole, okay? So the reason why the cervical vertebrae has a hole is because of this vessel, the vertebral artery. So everything makes sense now. Back then, we actually had difficulty trying to actually differentiate the cervical vertebrae from the thoracic, but we noticed that the cervical vertebrae has a hole onto the transverse foramen. Now, with that hole, we now understand what was the reason why the hole exists. It's because the vertebral artery will have to pass through the transverse process and meet up into the brain with internal carotid artery. Okay, so that's your B. And the next one is going to be I. Okay, I, internal thoracic artery. So look for a vessel that goes inside the thoracic cage. The I is internal thoracic artery, right there. Goes inside the cage. So my branches of subclavian artery is CTVI. Okay, that's the branches of my subclavian artery. Okay. So with this, now you actually say that people who go to anatomy, they if they actually persist and they can memorize this, then the next step is going to med school or nursing, because you got to know those blood vessels, because when you go for surgical nursing, surgical nurse, you're going to be assisting the patient, because upon incision, sometimes the blood vessel gets cut, and you want to know what blood vessel was cut within that operation. So that's called the surgical nurse. Okay. Now, next is going to be, I want to actually take a look at the branches of uh, the circuit of Willis. Okay, remember this, we're in the brain now. Okay, so this now makes sense about what happened to the vessel from the heart and the branches of the arteries. Then it goes into the brain. Okay, now remember on the front, the internal carotid artery is the one that will penetrate the skull to go into the brain. The hole is called the carotid canal. So we study the carotid canal. Now the back, it will pass through the side of the vertebrae, then just go through the foramen magnum. And that's going to be the vertebral artery. So those two vessels are coming from opposite side. And this one is your internal carotid artery. Okay, so let's trace the internal carotid artery, what branches that it make. The internal carotid artery will make a branch called the middle cerebral artery. Okay, and where does it go? Okay, does it actually go and give oxygenated blood to the area called the precentral and the postcentral gyrus? Does that make sense now? So if you have a clot over a blockage here, it will kill the pre and the postcentral gyrus. And what does killing the pre and the postcentral gyrus do? Stroke. Because remember, the precentral gyrus is motor, the postcentral gyrus is sensory. So if you kill off that part of the brain, the pre and postcentral gyrus, now you got a stroke. Paralysis one side of the body. The stroke exists on the right side of the head, the blockage of the middle cerebral artery, and it paralyzed the left side of the body. Why? Because remember, the nerves travel from the right side and decussates to the left side at the area of the medulla oblongata. Remember the area called pyramidal decussation. Okay, so that explains to you why the paralysis is going to be at the opposite side, because the nerves decussate to the opposite side when it reaches the medulla oblongata. And that's the reason why we study pyramidal decussation. Okay, so the middle cerebral artery, that's the one that goes into the your pre and postcentral gyrus. But there's another branch of the internal carotid artery. That's the one that goes into the frontal lobe. Okay, it actually gives oxygenated blood to the frontal lobe. So those are the two branches of the internal carotid artery. Okay, now who's gonna give oxygenated blood to the back of the brain, the occipital lobe? Okay, so that is going to be coming out from the vertebral artery. Remember, there's two vertebral artery going up into the foramen magnum. So they're just to the side of the transverse foramen of the cervical vertebrae. So when they go up, they actually form one vessel, and that's going to be called the basilar artery. So that vessel is called the basilar artery. And then after that vessel, it'll change, it actually give a branch to the occipital part of the brain. Now that branch is going to be the posterior cerebral artery. Okay. So now, what are the branches that gives oxygenated blood to the brain? The anterior cerebral, the middle cerebral, and the posterior cerebral. Okay, and that's going to anastomose and turn around to the head in order to the brain, in order to give oxygenated blood. Okay, now why do we call this circle the circle of Willis, or what we call the spider of Willis? Okay, remember, these are tools that we use in med school. So when you want to memorize something, you want to make it easy for the brain to memorize. Okay, because if you go to nursing, you're gonna go back into your anatomy, no matter what. So if you actually are so in anatomy in the community colleges, when you go to the nursing program, you're gonna go deeper into this anatomy, because remember, who's gonna ask you after the nursing program about anatomy? The NCLEX exam. So they're gonna be asking you, what are the branches of the internal carotid artery? And where does those branches go? So most of the questions in the NCLEX exam are cases. So why did the patient have a stroke? So what part of the brain died? It's going to be the pre and post central gyrus. What's the common cause of the death of the pre and post central gyrus? Mostly it is a clot blocking the middle cerebral artery. Where does the middle cerebral artery come from? The internal carotid artery. Those are the questions that they ask in NCLEX. Those are the same questions they ask on our licensing exam. Okay, so it doesn't make sense if you pass nursing and then you didn't pass NCLEX, you don't get your license, so you don't work. Okay, so again, I'm trying to actually have you in a better position. You study anatomy so that you can actually pass your NCLEX exam. Okay, so if you actually don't know what's the passing rate of the NCLEX exam for the nursing program of the different colleges, type in RN NCLEX passing rate. It'll give you all schools with a passing rate. Okay, so if you see something like 80% passing rate on a school, that means that out of 100 people who took that license exam, 20 failed. Okay, so it means that they went through 4 years or 2 years of nursing, but they could not go through to the nursing career because they couldn't get their license. So you want to actually take a look at a school that has a 90 plus passing rate of the NCLEX. And that is actually the one that you will research, because remember, I'm not going to take the NCLEX exam. You are going to take the NCLEX exam. So look for a school that helps you for that NCLEX exam. So it means that if a school like, I'm not saying mine is a better school, but Moorpark College, I teach at Moorpark, we always have 97, 98% passing on NCLEX. That means that something is happening there. So probably the teachers are so good in teaching the students that they pass. Okay, so you have to find your school. Now I'm doing this for you so that once you get your NCLEX exam, so you will actually understand what are the questions of the NCLEX exam. Okay, so now why did they call this spider Willis? This is how to memorize it. Okay, remember it looks like a spider. Okay, haven't you noticed? This is going to be the leg of the spider. This is the body of the spider. It has arms that goes to the pons of the spider. And then it has a big arm that goes to the occipital lobe of the spider. And then this one connects the basilar artery to the internal carotid artery. That is going to be called the posterior communicating artery. Now that's going to be his jaw, the spider's jaw. And this one has the branch of the anterior cerebral artery. And then they connect to each other here, called the anterior communicating artery. That's his head. Now, this spider has arms here, called the middle meningeal, and he has an antenna here called the middle cerebral here, anterior cerebral here. And then he has horn of the optic nerve, and he has a nose called the pituitary gland. And doesn't it look like a spider? The only missing here is the smile. Okay, so that's how you actually try to memorize your branches of the arteries located in the brain. Okay, so the most common question here: name two vessels that give oxygenated blood to the brain. The choices are: is it going to be the external carotid in the internal carotid, or is it going to be the vertebral artery in the internal carotid, or is it going to be the vertebral artery in the external carotid? The two branches are the vertebral artery and the internal carotid. Okay, so that's one of your NCLEX exam. All right, next. So we're gonna move forward. Okay, so we finished with blood flow of the head, neck, and that came from the arch of the aorta. Okay, now we're gonna go forward and take a look at the other branches. Okay, so this is now the other branches I want you to know, and this is gonna be the branches of your axillary artery. Okay, axillary artery. What are the branches? TL Spadu. Okay, so again, the name of the vessel is actually where it's going at. Okay, the location. We don't invent names. We actually just tell you the name where it goes to, and that's going to be the branches of the axillary artery. First, T, thoracoacromial artery. Okay, I should look for a vessel from the axillary artery that goes to the thoracic and the acromion. Okay, so this is the axillary artery. So I'm looking for the vessel, thoracoacromial. So this one is the one that goes into the acromion process and to the thoracic cage. That's your thoracoacromial artery. That's your T. Now, L, what is L? L is going to be the vessel, okay, that is called the lateral thoracic artery. The lateral thoracic artery is a branch of the axillary artery that goes down here, okay, to the side, okay. It says lateral, it's the side of the thoracic. That's your L. And what is S? The S is going to be the subscapular artery. So which should I look for that vessel of the axillary? Oh, I should look for a vessel that goes to the subscapular fossa. There you go. That is your subscapular artery. And then P and A, okay, it's called the posterior circumflex and the anterior circumflex humeral artery. So I should look for a vessel that goes to the humerus. It wraps around the humerus because it's called a circumflex. It circles the humerus. This is the anterior circumflex, humeral circumflex. This is going to be the posterior humeral circumflex, and they wrap around the humerus, okay? D, that is going to be your deep artery of the arm. So a branch here of the axillary, okay, that will go into the vessel called the deep artery of the arm, not the brachial artery. So it goes to the back of the arm and goes to the front. That's your D. And the last one is going to be U, ulnar collateral artery. So a branch of the axillary that will then go into the back of the ulna. So they're collaterals, okay? And that is U, okay? So you finish with branches of your axillary, okay? So we finished with all those. We did the branches of your common carotid. We did the branches of your external carotid, okay? We did the branches of your subclavian artery. We did the branch of your axillary artery, okay? So now we're gonna be going into the branches of the abdominal aorta, okay? So we finished with those branches. So the thoracic aorta from the descending aorta will penetrate the diaphragm and will give branches into the abdominal cavity. This is going to be abdominal aorta. And remember, they're going to be divided into two because it has to go to the leg, okay? The first thing is, I want to take a look at the branches here. Now, there's branches that goes to the side. There are branches that goes to the front. And there's one branch that goes halfway into the middle, okay? So those are the three major branches. So the one that goes to the side, okay, this one here, it goes to the diaphragm, okay? What is Latin for diaphragm? Phrenic. Phreno in Latin means diaphragm, okay? So the inferior phrenic artery is the one that goes to the side. That's under the diaphragm. That's a branch of the abdominal aorta. Now the next branch, okay, is going to be the branch to the side. It goes to the adrenal gland. This is called the adrenal gland sitting on top of the kidney. So we're going to call it the suprarenal. Another name for adrenal gland is called suprarenal gland. So the vessel that goes to the suprarenal gland, we're going to call it suprarenal artery, okay? And then we have the branch that goes to the side. All of them are going to the side. It goes to the kidney. So Latin for kidney is renal. So the branch that goes to the kidney, I'm going to call it the renal artery. It's going to be the renal artery, okay? Next, we don't have any more side, okay? So now we're going to take a look at this thing that goes halfway to the middle, okay? This one is a branch of the abdominal aorta that goes into the gonads, or what we call the reproductive gonads. So this branch is a gonadal artery. If this is a male, this is a testicular artery. That's the one that will go down to the scrotum. If this is a female, the gonadal artery is going to be the ovarian artery. It will go to the ovary. Okay, so take a look where it actually goes halfway to the middle. Okay, not to the side, not to the front, halfway to the middle. Okay, that's your gonadal artery. So the last three is going to be vessel that goes to the front. Okay, so again, I said one was to the side. There's a couple to the side. One is halfway to the middle, and the other one right now I'm going to tell you is the one to the front. Three of them. So the first one is this vessel here that goes to the front. It gives out branches. That's going to be your celiac trunk, okay? The celiac artery. And then at the bottom is going to be the superior mesenteric artery. All of this goes into the stomach, to the lower, small intestine, to the large intestine, and to the rectum. So those are the balances that actually will give oxygenated blood to those organs that is located at your abdominal cavity. Okay, and the last of that, the one on the front, is going to be the inferior mesenteric artery. Those are the three vessels that go to the front: celiac, superior mesenteric, inferior mesenteric artery. Okay, all right. So finish with those branches at the abdominal aorta. Okay, but again, I need to see the branches that goes to the leg. The first one is going to be a branch that will divide into two, and that's going to be the common iliac artery. And the reason why I call it iliac, because this is the iliac bone. Okay, and then they're going to be dividing again into two. Okay, and the one that divides inside the pelvic cavity, this is going to be the internal iliac artery. So what should I call the one that actually is away from the inner side? I'm going to call it external iliac artery. Okay, so now I'm going down to the leg. Okay, so I finished with these vessels, okay, and the abdomen. Okay, now I'm going now to the leg. Okay, so again, I'm following it through here at the end of the abdominal aorta. This becomes the common iliac. It divides again into two. This is going to be the internal iliac. This is going to be the external iliac. When it passes through this ligament, you just call the vessel femoral artery. Same vessel, okay? When it goes to the back of the knee, you call it the popliteal artery. And then after that, it divides to two, one to the front and one to the back. The one to the front, I'm going to call it, because it's located at the tibia, I'm going to call it the anterior tibial artery. And the one to the back is the posterior tibial artery, okay? The internal iliac, I'm not going to be asking you to actually memorize the branches here. As long as you know the internal iliac is the one that goes to the pelvic arteries, going to the pelvic cavity, and this is going to be the external iliac that continues on as your femoral artery. Now, this is coming out from the back, and this will give me the posterior tibial here, and the one on the front is the anterior tibial. And they become an arch, and they give off digital arteries. So basically, that is the path of the artery towards the leg. And what we did finish is the map of your arterial system. Okay, it's not as bad. Okay, but we went through it. Okay, and we're looking now at the vein. Okay, so we're gonna go from here, and we're gonna look for the venous vein. Okay. So I want you to actually study the arterial systems the way I told you how to, memorizing the branches and where they come from. Always come from the arch of the aorta, and then trace it down to the brain, to the arm, and to the lower body. And that's how you should actually study the arterial system. Okay, so this is going to be the arterial system. See, those are the three branches that we went through. That goes to the brain on the left side. And then this goes to the arm. This will branch off to one to the brain and one to the arm. And then it goes down to the thoracic. And then it goes down to the abdominal. And then after that, it gives you the branches that I mentioned into the abdominal. Okay? So I'm going to actually Okay, pause, and we're gonna continue on with your. Um we're gonna continue on with your vein. Okay, so I'll give you a 2 minute break. Okay, and then we're gonna just continue on with the vein. Okay, I'll be back. I won't turn off the Zoom, so I'll just have it on.
Professor,
Yes.
sorry, I just have a quick question. I just want to make sure the exam tomorrow is to start at 4:30.
Hmm.
Okay, thank you.
It's 4:30 until I think I put it as 7:30. So you can actually have that big gap in which you
Okay,
decide when you want to take it. Because I
thank
believe that some people are working until 5 o'clock, and they said they should be able to actually access it like 5:30 to 6 o'clock. So you still have those number of times. So I'm gonna make sure if it's not 7:30 until I think it's until 8:30. Okay, I just want to be sure. Okay,
thank
all
you.
right, 2 minutes. Okay. All right, so we're back on our second part. Okay, so that finish the arterial system. Okay, then we're gonna go and take a look at the venous system now. Okay, and that finish up our topic. Okay, so on your venous system, okay, there's some things on the venous system that are unique. Okay, so you don't see in the arterial system, you only see in the venous system, and that is going to be the dural sinus and a hepatic portal system. Okay, so what is a dural sinus? So on the brain, okay, the blood vessel on the brain, okay, will actually be not a blood vessel of the vein. Okay, it's actually made out of a dura with a sinus in the middle. So it's a cavity of the dura mater, and that is the one that goes into the brain. Okay, so I'm going to start off here. So I see sinuses here, but then after that, it connects to veins here. Okay, and remember, it drains into your superior vena cava, and it goes down to the right atrium. On the arm, it has the same name as the blood vessel. Okay, it has the radial and ulnar vein. Those are deep veins. They're superficial veins. We're gonna do that separately. And then we have the brachial vein, the axillary vein, the subclavian vein, and then it goes to the brachiocephalic vein and goes into the superior vena cava. That's for the arm. Okay, so the abdominal aorta, it actually is going to go. I mean, the abdominal, the inferior vena cava, it actually came from the abdominal region and then goes up and then punctures the diaphragm and then goes to the right atrium. That's your inferior vena cava. Now I'm going to take a look at the tributaries that goes to my inferior vena cava, and that is going to be the anterior and posterior tibial vein, and it becomes a popliteal vein, and then it goes to femoral vein, and then from the femoral vein it becomes your internal iliac vein. Internal iliac vein is going to be called the common iliac vein, and then goes to the inferior vena cava. So if you notice, they actually just follow the name of the artery. Okay, but we have a couple of things that are unique: superficial veins that you actually see just close to the skin. Those are the veins that we actually use our intravenous IV and take blood out from. That's from the superficial veins, but deep veins follows the arteries. Okay, so the first one is going to be unique. These are called dural sinus. So dural sinus is actually not a blood vessel. So it's just like two dura matter and producing what we call a hole, a sinus. That's the reason why we call it a sinus instead of a vein. So we got one onto the top, that is between the cerebral hemisphere, that is called the superior sagittal, and then we have the one just close to the corpus callosum, okay, and that's going to be the inferior sagittal sinus. Both will actually come into what we call the junction, and then it becomes what we call the transverse and then sigmoid. Okay, so the vessel goes from superior to the transverse and to the sigmoid, or the inferior to the transverse and sigmoid, and then from there now it actually becomes a vein. Okay, and that is going to be the internal jugular vein. Okay, so we start as sinus, then it becomes a vessel called the vein. Now let's take a look at the vessels here. Okay, so the vessels actually just follow the arteries. We have the superficial temporal vein. We have the occipital vein. So I'm not actually telling you to actually go and look for where it goes. I'm just telling you that it always follows the artery. We have the facial vein, and then we have the posterior auricular vein right here to the ear, at the back of the ear. Okay, and then we have now the external jugular vein, which is going to be this one, and we have the internal jugular vein here. Okay, they're separate. Then in the middle is going to be the vertebral vein that follows the vertebral artery through the transverse foramen. Okay, so basically, those are the venous system located at the face and neck. They always follow the arterial system. They carry the same name as the arterial system. Now, these three are the ones that will drain into what we call the brachiocephalic vein. So the brachiocephalic vein drains the external jugular, the vertebral, and the internal jugular vein, and then it's drained by the brachiocephalic vein. This is the right. There's also another one called the left, and then they go into the superior vena cava, and after that goes to the right atrium. Okay, so basically those are the names of the veins located in the neck and your head. Now let's look at the arm. Okay, so the light blue structure are the deep veins. They follow the artery. Same thing. They actually have digital veins. They have the venous arch, and then they actually have the radial vein, thumb side, okay, and the ulnar vein, pinky side, and then they become the brachial vein, axillary vein, subclavian vein, and then from there it becomes the brachiocephalic vein to the superior vena cava. Same deep veins. The only unique thing about this area here is because of the superficial vein. This is the one that you will actually put IV. Okay, so these are the veins you can see just on top of your skin. So there's two veins that are located to the side. Okay, this is called the cephalic vein. It runs from the arm to the forearm. That's going to be on the thumb side. And this one is on the pinky side. This is a superficial vein called the basilic vein that runs to the medial side, cephalic and basilic. Okay, and also that on the forearms, cephalic and basilic. The two would actually connect here in the middle, and that's called the medial cubital vein. Okay, so if you remember, we take blood out from the medial cubital vein. Okay, so that is actually in the middle of the median cubital fossa. There's another one that branches off here in the middle between the two, and that's going to be the median vein of the forearm. Okay, remember, superficial veins are only seen on veins; they're not seen in arteries, and that's the reason why they're unique on the vein. Okay, so we got the sinus is unique, superficial veins are unique, and then there's another one here that's unique. This is called the azygos system. Okay, if you notice that the heart occupies this space, so there's going to be a hard way to give veins to the ribs. And that's the reason why we have the azygos system. Okay, the azygos system is a connection. So I'm going to take that label out again. Is a connection of the superficial vena cava connecting itself to the back with the inferior vena cava. Okay, because remember the vena cavas are cut off because the heart is in that structure. So I need a vessel that can actually give off intercostal veins, okay, to follow the intercostal arteries. So that's going to be the azygos vein. The azygos vein is connection with the superior vena cava and the inferior vena cava, and afterwards they actually give branches to the ribs. Those are the intercostal vein. Okay, and there's going to be one parallel here called the accessory hemizygos and zygos. Okay, so we'll actually get a better picture of that on the next picture, on the next slide. Okay, so these are your cephalic vein, basilic vein, and the medial cubital vein, and the medial vein of the arm. Okay, so make sure you know where those veins are because you're going to be actually doing the IV insertion, and these are the veins that you're going to utilize. Okay, so this is going to be the azygos system. Azygos system is connection between the superior vena cava and the inferior vena cava. When it connects, it's going to give you branches or intercostal veins right here. Okay, but the ones to the left, it has to make two systems called the accessory hemizygos, and the other one is called the hemiazygos vein. They're the ones set up for giving branches to the left side. Okay, so this is unique on to the vein. You don't see it on the arterial system. Okay. All right. So next, one thing unique is okay. I don't see the branches from the arteries that comes out here. I don't see the celiac. There used to be a celiac in the abdominal aorta, right? And there was a superior mesenteric artery in the inferior on the abdominal aorta, in the inferior mesenteric in the abdominal aorta. For the vein, that does not exist because it has a certain place to produce that vessel. So the only thing that you see there is called the hepatic vein, and this is the one that connects with the liver. Okay, so this is your hepatic vein. So liver connects to the hepatic vein and then connects to the circulation of the venous system. Okay, so that's the hepatic vein, and we're going to study with that called the portal venous system. Okay, but for now, let's take a look at some of the branches here. I have the same branches that we have in the artery: inferior phrenic, suprarenal, renal, and I have the gonadal here. And then it branches up as the common iliac vein. Common iliac vein divides into the internal iliac vein and external iliac vein because it's actually similar to our artery. There's one thing unique about this. Usually, the suprarenal artery comes from the aorta, but here, instead of actually coming to the aorta, it actually taps onto the left renal vein. Okay, it then goes from the inferior vena cava. It actually taps at the renal vein, and usually you have this vessel here called the gonadal arteries. They go side to side, the main vessel, but it didn't happen here. So they actually instead tap it from the left renal vein, and that's going to be the gonadal vein. Okay, so that's actually very unique onto the vein. The left side taps onto the left renal vein instead of the inferior vena cava. Okay. All right, now we're going to take a look now at what happened to this portal system. Okay, so the hepatic portal system are vessels that collect nutrients from the intestinal tract. So remember, whatever you digested is going to be carried by the venous system of the hepatic portal. So these are your superior mesenteric vein, and these are your inferior mesenteric vein. So this is where the mesenteric vein goes. Because remember, the mesenteric arteries were the branch of the aorta, but here they're actually separate. So they take in the different branches and then they become one as a hepatic portal vein. So food that are digested will be brought in by the hepatic portal vein through the branches called the superior and inferior mesenteric vein. When it goes as the hepatic portal vein, this vein will then go into the sinusoids of the liver. Okay, so what is the purpose of that? Why does it have to pass through the liver? The liver will actually detoxify or metabolize things that are not supposed to go into the systemic circulation. So the liver will always be the first thing that will actually will be looking at whatever's absorbed and whatever's not supposed to be going into the systemic circulation. He's gonna throw it at bile. He'll make bile, and then it'll go to the feces. But whatever he allows, it will then connect to the back called the hepatic vein. And then from the hepatic vein, we have the inferior vena cava, and then to the right atrium, and then to the circulation. Okay. So with this concept called the hepatic portal system, everything will always pass through the liver. That's the reason why medicines taken orally, okay, does not actually have a fast-acting effect because it still has to pass through the liver. So usually when you actually take about 150 milligrams of antibiotic, the liver only lets you let it in only about 20 milligrams. So they're not going to take all the 150 milligrams into the systemic circulation. The liver will metabolize and actually neutralize whatever medicine it is, and they're going to throw it to bile and then to the feces. Okay, so that's the reason why we have the liver effect. Okay, so whenever you want to give a fast-acting drug, don't use oral medication because it'll pass through the liver before it goes to the systemic circulation. If you want to actually put the drug right away to the blood, you do the IV insertion. Okay, that's why you actually had to put intravenous medication, and that's the one that you will actually allow that medicine to go directly to the systemic circulation. Okay, so the hepatic portal system also explains to you why people who drink alcohol would actually have a liver cirrhosis. Because guess what? The alcohol is going to be absorbed by the superior and inferior mesenteric vein. It's going to go to the hepatic portal vein. And then it's going to go to the liver, and the liver will detoxify most of the alcohol. Some of them got through, it will go to the hepatic vein, but most of them is going to be detoxified, and the alcohol will actually damage the liver. And that's the reason why people who are alcoholic will actually produce what we call alcoholic cirrhosis. Okay, alcoholic cirrhosis, the liver is going to be as hard as stone because there's actually damage already. So the hepatic portal system directs all that is being absorbed from the food or whatever is a waste, it will actually be passing by the liver. And that is unique on the vein. Arterioles don't have that system. And that's the hepatic portal system. Okay. So next, we're going to move on. And this is how it looks like. Okay. So this is going to be the hepatic portal vein. So whatever you absorb from the intestinal tract, and whatever waste like carbon dioxide is actually floating now on this portion here, is going to flow into the hepatic portal. The hepatic portal will then go into the liver. And remember, there's a lot of sinusoids or holes located in your in those vessels that are located in the liver. So the toxins or nutrients, sometimes they have to leave, and then the liver cell will actually try to detoxify some of them. Whatever is a lot go through will then connect to the hepatic vein, and now goes to the inferior vena cava, and then goes to the right atrium, and then goes out to the aortic vessel. Okay, so the liver is always like a sentinel. It guards anything that goes inside your body. Right. So let's now look at the vessels on the limbs. Okay. So we actually finished the vessels on the arm, and they actually follow the same as the arteries. The same thing as the vessels on the leg. They follow the arteries, except for two superficial veins that you'll see here. So I'm going to trace the vein. Okay. The same thing as I trace your arteries. Okay. The metatarsal vein is similar to the digital veins, and we have the digital arteries also. And then we have the venous arch, and we have the venous arteries arch also. And then from there, it's going to go to the anterior tibial, or what we call the posterior tibial. We also have that on your arteries. And then they meet here as one to the back of the knee. We're going to call it the popliteal vein. And then after that, it goes to the thigh. We're going to call it the femoral vein. And then from there, it goes into the pelvic cavity. We're going to call it the external iliac vein. And then it's joined by the internal iliac vein to become what we call the common iliac vein. And the common iliac vein then goes as your inferior vena cava. And then from there, it will penetrate the diaphragm to become an inferior vena cava to the thoracic cavity. And then from there, it dumps its blood to the right atrium. Okay, so it's actually just follow the same path. The two superficial veins that are located in your leg is the great saphenous and the small saphenous. Okay, so this is going to be the great saphenous and the small saphenous. I'm going to take out the label. The great saphenous is the one located in the medial side of your thigh. It actually comes out from the femoral vein. Okay, and then it goes down here and connects with the arch. This is superficial. You can actually see to the side of your thigh. Okay, that is called the great saphenous vein. Okay, so the small saphenous vein, they're actually just a small vein that empties in the popliteal vein. So that small saphenous vein is just emptying out here at the popliteal vein. So it's not even labeled here. So it's going to actually empty out here. Okay. Now, what is the importance of great saphenous vein? This vein is the one that we harvest when we have to do a bypass surgery of the heart. Because remember, when there's a block of the heart, instead of actually roto-rootering that blockage on the coronary arteries, we just attach one end of that vessel, the great saphenous vein. So I'm going to cut it in small pieces, and then connect the vessel before the block and the other side of the vessel after the block. That's the reason why we call it a bypass. Okay, so the same here. This, let's say this is your right coronary artery. If there's a block here, okay, this is from the aorta. Okay, if there's a block here, so we get this vein, harvest it because it's superficial vein. And remember, you don't need those superficial veins. You just need deep veins. So I'm going to get a segment of that venous, great venous vein. So I'm going to cut a small segment there. So I'm going to connect one end of that segment here and then connect the other end here. And that is called a bypass graft. That is actually how we do bypass. So if you have a quadruple bypass, we do 4 of this, okay? And that's actually on the coronary arteries. Right, so again, we still have the same vessels as what we have for the venous system, and only 2 superficial veins there. I said the great saphenous, that's actually coming up to the thigh to the leg, and the small saphenous, the one that you see in the back, okay? This is the one that drains into the popliteal vein. That's your small saphenous vein. Okay? All right, so with that, we actually finished with the venous system. So this is all about your venous system and all about the branches of the arteries and the tributaries of the venous system. Now, let me actually just finish up a little bit on the circulation of the fetus. So the fetus circulation, you have an umbilical cord attached to the mother's placenta. The mother is actually giving the oxygen and carbon dioxide to the baby, okay? So it's gonna give that oxygen into the umbilical cord. Remember, there's actually an artery and vein in the umbilical cord. This is your umbilical artery, okay? Is gonna be, remember, arteries, we call arteries that goes away from the heart, and that is gonna be an artery, and the one that goes back to the heart, we're gonna call it a vein, okay? So there's one vein in the umbilical cord, and there's 2 umbilical arteries. Now, this vein that carries oxygenated blood will then go into the liver of the baby. From the belly button, it goes inside and it connects with the liver, okay? And that connection is called the ductus venosus. So an umbilical vein would actually connect into the liver through a temporary opening or a temporary duct called the ductus venosus. And then from there, it goes to the hepatic vein, and it goes to the inferior vena cava, and then it goes to the right atrium. And then remember, the baby's not breathing yet, okay? So when it goes to the right atrium, there's going to be a hole between the right atrium and the right ventricle. That hole is going to be the foramen ovale. So the blood from the right atrium literally goes directly to the left atrium without passing through the lung, okay? And that is called the foramen ovale, okay? Now, some of the blood was able to actually go through from the right atrium to the right ventricle. So now it's going to be pumped into the arch of to the pulmonary artery, right? So when it goes to the pulmonary artery, it has to go to the lung. But since the lungs collapse, this blood is now diverted to this canal or duct that connects to the aorta. So now you don't have any vessel that goes into the lung. The connection between the pulmonary artery and the aorta is called the ductus arteriosus. Okay, so you got the connection of the ductus venosus or foramen ovale and the ductus arteriosus in fetus that is still in the mother's womb. Okay, now when the child is delivered and the baby is able to actually breathe in oxygenated air, okay, pure oxygenated air, and it will literally close this holes in this duct in about 2 to 3 seconds. And that's the reason why we spank the baby, in order for the baby to cry, because when they cry, they actually breathe in that pure oxygen, and that will go into their blood, and it will actually close all those holes, okay? So after delivery, Okay, take a look what happened to the umbilical vein and becomes a ligament. And ligament is named the ligamentum teres. Okay, remember this goes into the what do you call your liver. So there used to be a connection here from the umbilical vein to the liver. We call it the ductus venosus. But when the baby is delivered, that closes, and we call it a ligament, ligamentum venosum. Okay, so turn into ligament. And then from there, it actually has a hole here before called the foraminal valley between the right atrium and left atrium. Now, as soon as baby is delivered, breathes in air, that closes, and we call it the fossa ovalis. And then here is actually a connection between the ligament, between the pulmonary artery and the aorta. Okay, as soon as baby breathes in air, that ductus arteriosus becomes a ligament. We call it ligamentum arteriosum. So they close. Okay, so the umbilical artery becomes a ligamentum teres. But what happened to the umbilical vein, umbilical artery? The umbilical vein becomes the ligamentum teres, and the two umbilical arteries, they actually turn into what we call the medial umbilical ligament. Okay, so all of them turn into ligaments, and that's actually what is the infant into newborn, the circulation. Okay, from holes it becomes ligament. All right, so we finish with vessel. Okay. And the only thing we're going to be doing right now is we're going to go and take a look at the models, okay, of the vessel. So I'll just give you a 15-minute break, okay? And with that 15 break, we will actually continue on into your models of the major vessels. And the model that is going to be presented to you is going to be called your flat man. Okay, the flat man has the blood vessels that will actually be the one that was going to be part of the exam. Okay, all right. So if give you a 15-minute break, so I would expect that we see each other at 5:30. Okay, so I'm gonna close this down so we have a copy of this video, and then I'm gonna ask you to do a second part and just go to the invitation. I'm going to put in an invitation, or you can actually just log on the same way. Okay. All right. So I'll end the meeting. See you at 5:30. 15-minute break only.